I'm Dr. Robert Merchant. I'm the medical director of the Reno Vein Clinic. Here at the Reno Vein Clinic, we provide services for varicose veins, patients who have these disabilities. As you may know, varicose veins affect about 20 to 25 million women in America and about 10 to 15 million men. Varicose veins can be very painful. They can either be aching, throbbing, you can have heaviness in the leg, especially if you've been sitting for a long period of time, or you can have some swelling in the leg, or they can feel very heavy, especially at the end of the day. One of the things too that seems to be associated with varicose veins is discomfort at night. In other words, patients who have been up on their legs for a long period of time may develop some night cramps or pain in their legs. And this is typical of patients who have significant varicose veins. Varicose veins are abnormally dilated veins in the leg. They sometimes can occur in other areas, like on the arm or in the abdominal wall or on the inner thigh. But the most important thing that these have in common is that the varicose veins show or demonstrate reversed blood flow. Instead of taking blood flow back to the heart like a normal vein would do with competent valves, these valves become incompetent, usually because of the dilation of the veins that are subjected to high pressure. And as a result of this, varicose veins develop and are progressive. They can lead to some complications. It's typical, perhaps 2% per year of the patients with varicose veins will develop complications such as blood clots, skin breakdown and ulcerations, and in some rare instances, bleeding can occur. Radiofrequency ablation is performed using a catheter that is directed with an ultrasound into the great saphenous vein below the varicose vein, and it's positioned right up in this spot. And what we end up doing is over a very short period of time, about 20 seconds per segment, a little 3-inch segment of vein is treated at one time over 20 seconds for each segment. What it does is it ends up closing that vein down. So in this situation, it takes this inefficient vein. What's happening is that in the normal situation, blood flow comes up through the tributaries and then it goes down this abnormal vein. When we have eradicated that vein and closed it down in its place, then the blood flow now will go through normal channels in through these other little vessels that are left in place. And you'll notice the difference immediately. Stripping has been around since 1907. It was first introduced by Dr. Blaylock at that time. And he advocated radical stripping, which means just complete removal of this vein and tying off all the tributaries up in the groin. This requires a large incision in the groin and then a catheter placed down through the vein, and then the vein is stripped out, or what I refer to as straight ripping. And that's exactly what occurs here. It takes out other additional subcutaneous tissue, a little nerve tissue, and lymphatic tissue. So it results predictably in about 10 to 15% of the patients will develop neurological pain and numbness related to the procedures. This is why we advocate the use of endovenous thermal ablation techniques. Here at the Reno Vein Clinic, we employ the radiofrequency closure fast procedure. In the last 10 years, we've been doing radiofrequency ablation here at the Reno Vein Clinic, and have found that this is far superior to stripping of the veins. The patients are comfortable. They get back to normal activity in one day, back to work in about 3 or 4 days. This is the typical expectations that one can look forward to. This has been demonstrated by multiple randomized controlled trials that have compared surgical stripping with radiofrequency ablation, and the results are very clear.